Hello everybody, welcome to chapter 36, Disorientation, Delirium and Dementia. In this chapter, we are discussing about the changes in the human brain, certain neurological disorders. These are age-related brain changes. Changes in the brain and nervous system occurs with aging. Confusion, delirium, and dementia are not the normal part of aging. Certain disease that affects the brain. Certain changes in the brain can affect cognitive function and social function. Certain cognitive function related to using the language, communication, exchange of words. The term cognitive related to the knowledge. Cognitive function involves the following, such as memory, critical thinking or thinking. Reasoning means rationalizing the ideas, ability to understand others, get knowledge from the external sources. The judgment also impairs with those cognitive functions and certain behavior. People with these spectrum of the changes in the mind, their behavior goes beyond the normal behavior. However, these are the changes are not the normal parts of aging. When they have certain neurological disorder, the disorder that goes in the brain, the cognitive function of the brain and the nervous system deteriorates, and these are the changes in human behavior. Changes in the memory, changes in the thinking, changes in the reasoning, ability to understand others, making judgment of something, and behavior pattern, the pattern of human behavior, all they get changed. Let's begin the discussion from disorientation. Disorientation, it is the state of acute confusion. It's also called confusion and has many causes. When a person is disoriented, the person has so many function changes in daily life. Urinary tract infection, one of the main causes of confusion or disorientation. Remember the first region, urinary tract infection. In this section, we have to remember who are more prone to get the urinary tract infection. Women are, because their urethra is shorter than men's. Elderly women are always more vulnerable to UTIs or urinary tract infection. Always keep in mind. Another could be alcohol intoxication. When people drink alcohol, they get disoriented. When person has low blood sugar, it is called hypoglycemia. Low blood sugar, people may have disorientation. Head trauma or injury, when somebody falls from the bed or falls from the stair, people may have the head injury that leads to confusion. Nutritional deficiency, people don't eat the balanced diet. What type of diet people need to eat in Canada? Healthy eating according to Canada's food guide. Follow, that is the best way of keeping nutritional demands sufficiently. Similarly, when people have certain febrile condition, fever, increased temperature, they may have got disorientation. Certain medication, it causes disorientation. And even some hallucination. Certain mental health related medications are very dangerous because their dose must be very accurate as prescribed by the doctors. When people don't sleep for adequately for 7-8 hours, they may have certain sleep deprivation, and it leads to disorientation. Seizure, when people start seizing, they fall on the floor and start shaking the whole body. Sometimes they bite their tongues. These are called epilepsy or seizure. We already discussed about it in our previous classes as well, and others. So basically, disorientation is confusion, disorientation about the person, place, and time. Disorientation sign and symptom. It is very important in elderly care homes like nursing homes, long-term care homes. So the sign and symptom of disorientation begins often exhibit. It means usually it shows. The behavior changes and may be angry, restless, depressed, or irritable. Basically, these are the sign and symptom of disorientation. Person becomes violative in behavior, and person demonstrates certain changes in the behavior because of the depression, because of the restlessness. Person becomes very much angry about normal things. Other symptoms may include anxiety, tremors. Tremors means shaking of the body. It's all about shaking body. Hallucination, generally the people who are alcoholic and who use certain street drug, mental health related drug, they get hallucinated. Delusional are even the worst case because people have a fixed false belief. Decline in the level of consciousness, LOC, level of consciousness. Remember, when you document in the long-term care as a support worker, you have to know all these abbreviations. Level of consciousness, it is being decreased, gradually decreasing. They are totally confused. Disorganized thinking, because we think in a certain context, because thinking without context looks bizarre. That's why people of those disorientation situation, they think there is no connection between the word and the meaning they want to express. It is called disorganized thinking. Their speech is impaired. They try to speak in a smooth way, but they cannot do it. The speech is impaired. And attention problem. When you go to somebody's room, in the client's room, and tries to take the attention, you want to say, hello, Mr. A, good morning. This is a time to wake up. It's morning, 8 o'clock. Now you have to go for the breakfast. I am here to make you ready. Let's change the dress. Let me provide you morning care. But the person does not listen to you. That's called attention problem. So these are the normal pattern of the sign and symptom people show who are diagnosed with disorientation. Ways to minimize or prevent disorientation. So this is how we need to know how we can help those people who have disorientation, how we can help the people, how can we minimize their level of disorientation, how to bring them back to the normal orientation phase from the disorientation phase. So let's be very careful in these points. These are everyday business of our job, our activities. People are disoriented, and our duty is to reorient them, to bring them back to the orientation. So we have to expose to the reality to them so that they can know the person, they can realize the changes of time, and they know that where they are. So getting regular hours of sleep. We have to encourage the clients, the resident, about their sleeping time so that they will have enough sleep and they can minimize those disorientation. Similarly, the second point talks about eating a balanced diet, and that has a plenty of vitamins and minerals. These vitamins and minerals in the diet, they help to metabolize the food, digest the food properly, and the person getting enough vitamin and minerals, they have a healthy body, and healthy body goes with the healthy mind, and healthy mind goes with the healthy body. They are going simultaneously. That's why a person's diet must be nutritional, full of nutrition, vitamins and minerals. Similarly, another point says not drinking alcohol in excess. In certain culture, drinking alcohol is forbidden, whereas certain culture, people can normally drink certain level of alcohol. That's why if the person has a habit of drinking alcohol, we have to encourage them not to drink alcohol in excess or drink as recommended. Similarly, we are helping the person keeping careful control of blood sugar. People may have a diabetic. Their blood sugar should be controlled in the normal range. And if the diabetic person's blood sugar goes beyond the normal range, people definitely have confusion. So, if the person is diabetic and person is controlled, the person is not oriented, the person is disoriented, our duty is to call the nurses and double check with the blood sugar level, what's going on in the blood sugar. So, not smoking. Smoking Smoking gives nicotine in the mind, in the central nervous system. The nicotine of the smoking makes people confusion. That's why we have to encourage the person for the cessation of smoking. Now, we are coming to another confusing state. It is called acute confusion. Confusion caused by certain condition. It's called delirium. Delirium is a state of temporary but acute mental confusion. Let's see how is delirium a state of temporary for the time being, for the short period of time, it's called temporary, but acute. It's all of the sudden it starts. Acute mental confusion. Remember, onset means starting. Starting is sudden. Suddenly it starts. It is common in older adults with acute or chronic illness. It is common in the older adults generally. It can happen to anybody, but it's very common in the older adults and who are having diagnosed with certain acute or chronic diseases. And the common causes of delirium includes reaction to medication. People in the long-term care home, they may be taking so many types of medication, and because of the multiple medication when people use, one medication reacts to other medication. They are contraindicating with each other, and this contraindication of the medication, it causes confusion, and that confusion we relate with delirium. The next point could be infection or other diseases. When people have infection, they are confused. Usually, the elderly population who have UTI, urinary tract infection, this is a most common form of infection, and infection is one of the cause of delirium. Poor nutrition. When a person has a confusion, acute or chronic confusion, we have to check, is the person taking good nutrition? What are the food intake the person has? We have to double check with the food supplies or what type of food the person eats. Food poisoning. Another could be food poisoning. Certain food we we can see the certain food, they causes poisoning, they causes sensitivity, they upset the GI tract, gastrointestinal tract, and they becomes the poison in the human body. That's why we have to double check with that. At this point, we do not check any lab and other report, but we are just observing, documenting, and reporting as soon as possible, because sometimes it can be life threatening. We have to report to the supervisor and to the nurse. Dehydration. How much fluid the person has taken in a day? We have to always double check with the fluid and food intake. Emotional trauma. When somebody has certain emotional condition, in this situation also people may have confusion, certain emotional. They happen to hear somebody tells them some bad news or certain news that they hear out of the blue, all of the sudden, and it leads to the emotional trauma. That's why they might have confusion by that too. And major life changes, example, the death of the loved one. In the elderly people, they always have this delirium confusion when they hear the news about the major life changes. The death of the husband or death of the wife or death of the loved one, including their pet animals. It is very difficult to tolerate for them, and they get confused about that. So delirium is an emergency. When a person is continuously delirious, confused, when the person has a continuous delirium for the long time, it is a medical emergency. The cause must be found and treated as soon as possible. Now the third and the most important and the most common type of neurological disorder is dementia. Dementia is not a single disease. It is the broad spectrum of multiple disease and the progressive loss of mental function, cognitive function. This is called dementia. There are so many types of dementia. Dementia is a progressive loss of cognitive and social functioning. When the word dementia comes to we hear the word dementia, we have to locate it with these two, cognitive and social function. There is a complete changes in the cognitive and social function. Cognitive is mental function, like understanding others, communicating, thinking, making judgment. For example, a person with dementia may be going outside where the weather of the outside is severely cold, like -25. The person does not wear the coat and jacket to protect from the cold, because person's judgment is totally impaired. Person cannot figure out what kind of cloth is necessary while approaching those climates outside the house. And social function is all about making friends, living with the other friends, living in the family, living with other friends in the long-term care home, nursing care home, and all other home. So basically the cognitive function and the social function, these two aspects are totally impaired in dementia. Have you ever worked with the people having dementia? Maybe. If not, you may be encountering those disease and those conditions with the people. It interferes, it blocks, it hinders, it interferes with routine, personal, social, and occupational activities. What do you mean by that? A person diagnosed with dementia, it has different stages, stage 1, stage 2, stage 3. Those dementia, it's mild, moderate, and severe. related to stage 1, stage 2, stage 3. They are personal, social, and occupational activities. Personal activities is all about activities of daily living, using washroom, changing dress, going for the food in the dining room, in the kitchen, even cooking food, all are impaired. Social, making friends, to connecting with the friends or going for a job, all about the occupational activities, continuing their job, all these at personal level, social level, and occupational level. It means the professional level. In all the essential levels of human beings are totally impaired when a person has dementia. It affects the ability to perform simple tasks like bathing, dressing, eating, as we already talked about it. And the complex tasks like driving, managing money, their managerial and judgmental aspect are severely affected. And planning for the meals and working as a professional, they cannot do it. Dementia is a group of symptoms. It's not a single disease. It's a group of symptoms. Dementia is a group of symptom that may occur with certain disease or condition. It comes with another disease or condition and leads the person in very, very vulnerable condition. Dementia is not a normal part of aging. So, what does it mean? Dementia is not a normal part of aging. Of course, all aged people, all the senior people, all the people in their advanced age should not have dementia. That's why it is normal part. It's not the normal part of aging. But the people after 50s, they start showing the sign of dementia. It's a disease condition. It's a result of multiple progressive loss of cognitive and social function. And as I told you, there are different stages of dementia, like stage 1, stage 2, stage 3, or we can say mild, moderate, and severe. Some early warning signs include, so how we know that somebody has dementia? What are the early signs? It looks a little bit confusing. Recent memory loss means the short-term memory, recent memory, what you did last week. It's a recent memory, right? Yeah, that recent memory is lost. That affects the job skill. A person in a job must be updated with the recent activities, but the person with dementia has lost the recent memory. What the person did yesterday, last week, last month, this month, what is the person assigned to do the work? The person forgets everything. Problem with common task. What do you mean by common task? A common task is writing, reading, communicating, eating, remembering where the person has put the car's keys. Remember, the person with the first stage of dementia begins to forget the recent thing. He forgets where he put the hat. He forgets or she forgets where he or she puts the food. Problem with language. Person cannot use the appropriate language. Forgetting simple words. Person tries to remember, but the person forgets, keeps on forgetting simple words. Getting lost in the familiar places. Sometimes people even confuse to go home. They are lost in the familiar places. Misplacing things and putting things in odd places. Misplacing, as I told you, people forget where they put the car's keys. They don't know it. Putting things in the odd places. Generally, we put something in a familiar, usual places, but they put the things in odd places. Like maybe they put the cars in the fridge, and they might put the breads under the table. Personality changes. Person becomes all of the sudden, it's called abrupt changes in the personality. Person becomes angry. Person shows unnecessary temper. Poor or decreased judgment. As I already discussed, person has a lack of proper judgment, like going outside in the selection of the dress according to the outside weather temperature. It's a very poor judgment. While driving, people may have a poor judgment and meet an accident. It's called motor vehicle accident, MVA, which is very common in the nursing and in the hospital. So many people visit emergency and because of the motor vehicle accidents. Loss of interest in life. To continue the life, there are so many things a person has to do every day, but they have a loss of interest in life. They look frustrated. They are depressed. They don't have optimistic view of life. They look pessimistic. Similarly, we are coming to here supporting the clients with dementia. Remember, a client with dementia, it may be sometimes very difficult to work with the client having dementia, but every support worker, they are supposed to work with those clients with the confusing state of delirium, disorientation, and dementia. And majority of our clients in the facility or in the community are having those neurological health issues, confusion, delirium, and dementia. So, while working with the dementia, the client with the dementia, the first and the most important thing is our communication, how we communicate. Therefore, try to communicate very nicely. In healthcare setting, it is called therapeutic communication. You have to be using very short sentences, clear pronunciation, and your communication should be very, very clear, and the person who can understand. Do not use complex sentences, short, simple sentences they can understand. You have to use that. Safety. People are always confused. They might fall at any time. They have a poor judgment. They cannot figure out if they can fall or not. That's why the clients with the dementia, the resident, the person with dementia, when we work with them, for safety is the number one concern. Wandering. They walk everywhere they like. A client of room number 302 might go to fourth floor and lives in room number 502. They are wandering. We have to look after them. We have to follow them, and we have to reorient them. We have to give them reality exposure that this is your room. Mr. A, Mr. B, you are in a wrong room, in a wrong place. Speak in a very clear way and very nicely. Use your tone of voice very soft, because they can take it very offensively. Hallucination and delusion. Certain medication, they may cause confusion, hallucination. There are totally state of confusion. And delusion, they have a fixed false belief. Delusional people, if they say, like, they may think that you are there to kill them. They will yell at you. They are delusional. You have to have the patience for that. And sleep. Help them to sleep in time. They might be wandering the whole night if you work overnight shift. People with dementia, you can see all they are using their crutches, their wheelchairs. They are sitting near the nursing station. They don't want to go to bed in time till 1 o'clock or 2 o'clock. We have to encourage them to go to the bed as soon as possible, as soon as they are good to go. They get the food and they need the rest. We have to encourage them. And the basic need means using bathroom, changing briefs, and maybe putting the light on, something like that. Dementia are at certain level, dementia can be treated, but all dementia are not treatable. They are there until people live. Treatable forms of dementia. If changes in the brain have not occurred, if their brain is not very damaged, not severely damaged, and the changes in the brain have not occurred, some dementia can be reversed. The person can be brought back to normal state. Reverse means just do the opposite. They can be coming to the normal life like we have now. Treatable forms of dementia include metabolic problem, certain metabolic problem, it means digesting, absorbing the nutrients in the body, all they are related with metabolic problems. How the nutrients of the food goes to the blood and blood circulates them with oxygen in the tissues, and how they are fully nutritionally they are healthy. It's related with the metabolic problem which can be treated. Brain injury or tumor. Certain people may have certain tumor in the brain. If the surgical procedure occurs, the tumors are taken by the surgeons in the surgical procedure, they can be brought back to normal position. Alcohol. If a person has a habit of excessive alcohol taking, alcoholic, it's also called the alcoholic syndrome. If the person drinks a lot of alcohol, and if the person is given instruction, proper help, assistance to leave the alcohol, not to drink alcohol anymore, the person can be brought back to normal condition. Nutritional deficiency. If the dementia is the root cause of the nutritional deficiencies, we can change the nutrition. This is something we can change. Alcohol we can change. Brain injury we can prevent or we can treat. And metabolic problem we can treat, we can change it. Infection, yes, we can change it. It's not genetic. And poisoning, yes, we can prevent the person from potential poisoning. We have to keep the things away from their daily use things. Do not put the cleaning stuffs near the medication they put. Sometimes they are confused. They might be drinking poisons in the hope of drinking medication. So we have to be careful. And these are the dementia. If the dementia are caused by those problems, it can be reversible and treatable. Let's discuss about untreatable form of dementia. What are untreatable? It means we cannot treat them. All the medication given to the clients, the patients with those dementia, the medication is given just for the symptom management, not to reverse the condition, but to continue with the condition with the management of symptoms. Untreatable form of dementia include Alzheimer's disease and related dementia. Remember, Alzheimer's disease is one type of dementia. This is one and the worst type of dementia. It's a branch of dementia. Let's understand in that way. Alzheimer's disease. Alzheimer's disease, vascular dementia, another form is vascular dementia. It's related with the blood vessels in the body. Blood vessels in the body, that's why it's called vascular. Dementia with Lewy bodies. It's another type of dementia, just the name, Lewy bodies. Fronto-temporal dementia, the dementia when person's frontal lobe or temporal lobe is affected by the disease. It's called fronto-temporal dementia. Parkinson's disease. What is Parkinson's disease? Parkinson is the person who found this disease, and it's called Parkinson's disease. In Parkinson's disease, the person's hands are always shaking. Have you seen anybody with Parkinson? You will see them in the clinical placement or when you work with the clients with these disorders. Creutzfeldt-Jakob disease. Creutzfeldt, you can say Jacob or Jacob. Creutzfeldt-Jakob disease, CJD. Normal pressure, hydrocephalus. Normal pressure, pressure of the fluid in the mind, in the head. Hydro means water, cephalus means head. Pressure of the fluid in the head. Certain fluid in the head, there is a cerebrospinal fluid. That fluid is collected in the wrong place. And giving the pressure in the mind. It's called normal pressure caused by the fluid in the head, hydrocephalus. Substance-induced persisting dementia. Substance-induced means drug addict. They are using the different drugs. And persisting dementia, this because of the drug-related dementia, their loss of memory, social function, cognitive function, everything is totally impaired. Rennick-Korsakoff syndrome, little bit difficult name. Rennick-Korsakoff syndrome, another form of dementia. Other causes, HIV/AIDS, Huntington's disease. There is another person who found the disease, Huntington's, the disease, that's why it's named after his name, Huntington's disease. Multiple sclerosis and syphilis. These are some disease with the sexually transmitted type of disease, syphilis. Now we are going by each of them. Vascular dementia. What is vascular dementia? A vascular dementia, multi-infarct dementia, it is caused by small strokes. When there is a big stroke, a small stroke in the mind. A stroke means in the head. Caused by the small stroke, resulting in brain tissue death. So vascular, as we already discussed about, vascular means related to the blood vessel. Blood, there are two types of blood vessel. Arteries that carries the blood from the heart, veins that brings the blood back to the heart. The two vasculars. So whatever vessel of the blood is impaired because of the small strokes in the brain, small strokes, what happens in the small strokes? The blood vessel ruptures. In the simplest term, the blood vessel is broken. There is a leakage of blood in the brain tissue, and the brain tissue dies. It's the death of brain tissue death. These strokes do not necessarily lead to hemiplegia. It's a paralysis, but may instead cause changes in the personality or memory. It might be contributing for the loss of memory and changes in the personality. What do you mean by personality change? A change in personality means the person all of the sudden becomes violent, angry, frustrated, and so on. And the person changes the mood. It's called mood swing. All of the sudden, person thinks something very different out of the context. That's called personality change. And the loss of memory. The short-term memory is totally lost. They can remember only the past and the long-term memory. Like 90 years old person can remember when the person was 19 years old. That's the long-term memory of the past. Similarly, we are discussing about the Lewy body dementia. Dementia with the Lewy bodies, one of the most common type of progressive dementia. It progresses from mild to moderate to severe. It starts if it is not treated in time, or if it is not treatable, it goes to the progressive, like chronic condition, progressively going and going, worsening and worsening. Progressive dementia, progressive decline combined with the three defining features. One is severe fluctuation. It means changes, ups and down, fluctuation. Severe changes in alertness and attention. Alertness means the person knowing the reality, and attention, the person knowing what other people are commanding, directing, telling. There is a When there is a severe changes in the alertness and attention, person does not know what time is it of the day, or who are you there, or who the person himself or herself is. Person is fluctuating, sometime knowing the reality, sometime not knowing the reality. Recurrent means repeated. Recurrent visual hallucination. Hallucination, what happens? They see certain images, certain changes in the environment, and they fear of that. That's called hallucination. And Parkinson like motor symptom. Parkinson, as we already talked about this Parkinson, it is all about the shaking hand. Hand is not the constant. The motor skill of the brain is damaged. It's called Parkinson like motor symptom, means the hands are shaking all the time in the Lewy body dementia. Similarly, another is the fronto-temporal dementia. Fronto means front side. Temporal means of the temporal part of the brain, the near your forehead area, the fronto-temporal dementia. It affects the brain of that side of the head. Fronto-temporal dementia, rare form of dementia. It's a little bit rare, not much common like Lewy body dementia. It affects the frontal and temporal lobe of the brain, as we told. Frontal is mean the front side, and the temporal, the side of the brain where your ears lies, temporal area. Marked changes means certain changes in the emotional and social functioning. There are changes in the emotional. Person becomes violative. Person becomes excessively frustrated, sometimes crying, sometimes laughing. There is a fluctuation in the emotional state and the social functioning, making friends, going with the friends, talking with the friends and family member. The socializing function is also impaired. Let's come to Creutzfeldt-Jakob disease. It's another form of dementia. Creutzfeldt-Jakob disease. It's another form of dementia. Rapid progressive neurological disease. See, this is a rapid and progressive, continuously happening neurological disease. As we already discussed in the beginning of our class, all these we are reading today are neurological disorder. It's a neurological disease. The neuron, the nerves, the impulses that are being transmitted through the nerves, peripheral nerves and central nerve system, all these are affected by these diseases. And Creutzfeldt-Jakob's disease is a progressive neurological disease or disorder. It affects the people and even animals. Mad cow disease. If animals are affected by this type of disease, mad cow is the name of disease. Sign and symptom of Creutzfeldt-Jakob's disease is fatigue, It's a generalized fatigue, all body will be aching, tiredness, difficulty sleeping and insomnia. Person has a difficulty sleeping. What do you mean by insomnia? Insomnia is something related with the sleep disturbance. Person cannot sleep during the night, and sometimes the person is walking, talking in the sleeping mood. These are insomnia. Changes in the personality means the person abruptly becomes violent, angry, frustrated, depressed. Balance in walking and walking disturbances. The person cannot maintain the balance of the body while walking, the person might fall. So, at this point, our job as a PSW could be maintaining the client's safety, our resident's safety. This is always the first priority. And other stages of dementia, whatever is the form of dementia, type of dementia, but dementia are categorized in terms of their severity. They are categorized into 3 stages. Stages of dementia. Early stage is stage 1. It's called early stage. It's also called mild. Client is usually aware of the diagnosis and will be able to participate in decision affecting future care. All the residents living in the community or long-term care home or nursing home, which we call facility, they are aware of where they are, what kind of treatment going on with them, who are the main decision maker in their treatment process. They are aware of this and their diagnosis. Mild forgetfulness. Sometimes they forget very simple, ordinary ideas. Difficulty learning new things. They have a difficulty learning new things. They have simple mathematical problems, they cannot do it. Like addition, subtraction, they have a difficulty in that. Problem with orientation. Orientation means knowing, exactly knowing about place, person, and time. They are confused what time it is now. They cannot say it. Even they cannot guess it. They say early in the morning, if you ask what time is it, they might say it's a evening time. They are totally confused. And they have a communication difficulties because their mind is not processing properly. When we communicate, mind has to give us word selection according to the context. If we fail to meet the context, we cannot do the communication. We don't have the good words, proper words in proper place. That's called communication difficulties. Now we are going to stage 2, and which is called moderate or middle stage. Moderate or middle stage. In the stage 2, the disease condition has progressed remarkably. Further decline in the client's mental and physical abilities, both the mental and physical, even the psychosocial, all the activities are further declined. Memory continues to deteriorate, means declined. It's loss of memory in simple word. Memory continues to deteriorate. Loss of memory progressively continues. Client may forget personal history. See, personal history. Who are you? If you ask, person cannot tell who he or she is. May not recognize friends and family. This is the most serious condition. As a nurse, I have worked with the client diagnosed with the dementia. If the husband has a dementia, wife comes every day and gives care, feeds her husband, and the husband does not recognize his wife and yells at the wife very, very using very rough words. And they don't recognize each other, even the friends and the families, the wife, the husbands, everything they forget. And do not blame for the person. It is the disease to be blamed. It is not the person. So, and our role as a support worker is we have to have great patience. Remember, guys, this is a great job. It's the job. It's a rewarding job. You are working with the real human beings, the real people, and have empathy on them. Think that if you are in that condition, what you want, give the same care to these people who are in the critical condition of their lives. This is called empathy. And we people in the nursing, we must have to develop the different quality that's called empathy. And let's go to the stage 3, which is very severe, and the last stage, it's the late stage. Client incapable of remembering, totally out of the memory, cannot remember, communication, complete impair of the verbalizing process, carrying out self-care, totally depending on others. Care is required 24 hours a day. It's a continuous care. The person is totally bedridden. Person cannot walk. Person cannot talk. Person is totally confused. Nurses are there coming and giving the medication. We have to just look after them all hours. It is total care, and it's a 24 hours a day. And how we support the client with dementia. Remember, this is the most important. It's called nursing intervention. As a support worker, how can we help the client diagnosed with the dementia of the different stages? The first point is we have to focus on their physiological need, the basic need of life. It's the meeting basic needs. What comes in the basic needs? Feeding them, giving them nice care, communicating with them. Even if they don't communicate with you, you have to communicate with them. It's called respecting them, communicating with them, giving them shower, changing their dress, giving them mouth care, communicating with them. All these are the basic need of life. Safety, following the safety protocol. Everywhere there is a safety protocol. How we can transfer them from wheelchair to bed, or bed to wheelchair. While taking them to the dining room, we may have to transfer them from the bed to the wheelchair. When you transfer, it may be one person transfer, two-person transfer. If you are transferring the client with the mechanical lift or wheel lift, you have to have two-person workers, not the student. Even the 2 or 3 student cannot transfer a client from bed to the wheelchair or wheelchair to the bed. There must be, let me repeat, there must be a staff member of the facility when you transfer. And there must be 2 people while mechanically we transfer the client from bed to wheelchair or wheelchair to bed. Hygiene, this is a good hygiene. Their neatness, cleanliness, their dress up, everything, grooming. They might need to be, just care about the face or hair, or grooming, cutting their hair, and dress up. You have to do their dress up. Elimination, it's using the toilet for the bowel movement or the bladder movement. You need to take them toilet in a regular schedule pattern so that they feel that they are in the toilet, they have to do that. Nutrition and fluid, how much they eat today, you have to report in the flow sheet. How much they drink, how much fluid they took today. A milk is considered fluid. Milk, coffee, tea, juice, water, anything, they are considered as fluid. You have to document the nutrition, the food and fluid they take. Exercise, what kind of exercise do you think they can do? It's a range of motion, ROM, exercise. They are sleeping on the bed and you are stretching the hands and legs and doing some exercise until they are tired. Their tiredness you can visualize in their face. If they are excited to do that, you may continue with that. Otherwise, you have to do that. In the nursing care plan, their care plan gives the idea how long you have to do the range of motion exercise, because they are not going to the ground for playing soccer or basketball. They are bedridden, they are sleeping in the bed 24 hour, very confused, and their exercise is range of motion. It's called ROM exercise. Health issue, what are their health issue? You have to report the nurses. If certain changes in their alertness occurs, if they are even more confused, they are not responding, you have to report the nurse. And comfort, this is the time our job is to give them more comfort. Change the briefs as soon as they are wet, and create the environment so that they can sleep in time. We have to create the environment, because sleep deprivation is one of the reason for that. Dementia client, they do not sleep, they don't go for sleep. That's why we have to encourage them, we have to lead them to their bedroom, and we have to set up their bed, and we may have to put the light on or off what they want. We have to do that. It's not what we want, it's always what they want. And again, therapy and activity, sometimes physiotherapist comes there and works with that, and certain activities you may have to work with these clients with dementia. These are all the ways we as a support worker we can help the client, assist the client. And working with the clients diagnosed with the dementia might be very challenging. Remember, healthcare facility nowadays is the most challenging area of work, and we have to be very conscious about that. We have to have that ability to deal with those challenges. Generally, the challenges is the behavior of the people there. These behavior are common with the dementia. Wandering, they are going to other person's room, they are going to other floor, there may be different floor in the facility, or in the house. If the client lives in the house, the client might be going to the neighboring house. He or she forgets his or her own house. And sundowning, that's called the sign and symptom and behavior of AD increase during the hours of darkness. Sundowning means most common form of sign and symptom. Persons with Alzheimer's disease, AD means Alzheimer's disease. That's why during the evening time, always put the lights on. Sundowning means do not make the darkness in the room of the client who have the dementia or Alzheimer's disease. ED increases. See here, Alzheimer's disease increases during the hours of darkness. So the room must not be dark. Put the lights on all the way. Hallucination, seeing, hearing, smelling, or feeling something that not real. Person is hallucinating. The person might think that you are there to kill them. They will be hearing you are going there. They say, when somebody is coming to kill me, save me, hello everybody, they are yelling all the time. That's why you have to say them that you are there to help them. You have to be very careful with this sign and symptom of the client. Delusion, false belief. People have a false belief of something. Catastrophic reaction, extreme responses. People become very much violating and they can harm you. You have to protect yourself. Their reaction should be very much extreme. If it is a verbal reaction, they might use very, very offensive word. If it is a physical reaction, they might attack you. I have worked with the clients with those conditions. So many clients, they physically attack you as a nurse, as a PSW. Agitation and restlessness. They are not feeling calm, they are agitated, they are not feeling restful life, they are restlessness, they are wandering, turning and twisting, trying to walk, trying to sleep, again come to the sitting position. All of the sudden they want to sleep. It's a restlessness. They are always restless. Aggression and combativeness. It's a violative behavior. Another name for the violative behavior is called combativeness. It's like combat, fighting. And aggression means verbalization, excessive verbalization of bad words for other people. Aggression, anger, frustration, aggressiveness, screaming, yelling at you. Sometimes client may be yelling at you. You don't get afraid of that. These are generally sign and symptom of those disease. And by the way, never blame the person. We are healthcare worker. We are not somebody to blame the person. We have to think that it is the disease process that has led them to that condition. Abnormal sexual behavior. Some people in their 80s or 90s may not have the exact behavioral pattern, but sometimes they show abnormal sexual behavior. They might touch you, they might be telling you something unnecessary word. They sometimes touch your body parts. You have to be careful with that. Repetitive behavior. Sometimes they use the same word for so many times. They don't want to forget that, and they repeat all the times the same type of behavior. And something they do, they repeat. They repeat the words, they repeat the action. Both are the behaviors. And hoarding. Sometimes they are hoarding their medication, sometimes they are hoarding their foods, and so on. Basically, hoarding is just hiding the things. You try to give something and they take the something. For example, nurse gives the some tablet to eat. They say, okay, I will eat that, but they are collecting the tablets. They are not eating the tablets. That's how they are hoarding the things. Medicine, other stuff, anything. Caregivers need the family. So let's go with the caregivers need and the family. Who are caregiver of the client? Sometimes the family, sometimes the healthcare workers. Healthcare is sought when sick past sought is searched. Healthcare is sought when the family cannot deal with the situation or meet the client's need. Generally, what happens? When the client, the husband and wife live in the house, the husband is 90 years old, the wife is 85 years old. Sometimes the wife is unable to give the client care to her husband. That's why family cannot deal with the situation or meet the client's need. The client needs something more special care, more time to look after. In that condition, the caregiver needs becomes different. So home health care may be held for a while. Sometime home health care, the nurses, the PSW, they are visiting the client's home and assisting them for the client with the dementia. Remember, we are discussing about the dementia, and everything our discussion here is all about the dementia. And home care and home health care may be held for the while. Adult daycare is an option. There may be certain the whole day the adult people are gathered together and provide the necessary assistance who are diagnosed with dementia. Long-term care is needed. Now the long-term care support for them, long-term means until they leave, that type of support is most important at the last phase of other care. Family members cannot meet the client's need. Why did certain clients with the dementia need long-term care facility? because family members cannot meet the client's need. The client no longer knows the caregiver. The wife is giving care to her husband, but the husband does not know that his wife is giving care to him. The client no longer knows the caregiver. Family members have health problem. The person who is taking care of the client is diagnosed with another disease and the person is hospitalized for 2 months. What goes in that situation? Very, very terrible. That's why they need to send to the long-term care home. Money problems occur. If all people may have a different financial condition and all people may not be able to spend the money financially, sound financial condition, that's why government help must be found. The client's behavior represents danger to self and others. It goes when the client, this neurological condition, it goes to the mental health. Sometimes people think of self-harming and harming to others. It is dangerous. For the safety reason, the client must be sent to the long-term care facilities. And we continue. The client's medical care can drain family finances. Drain means just all the money will be drained. No money at all left at home. That's why they need certain help from the government. And the family has a special need. The family member, the family is the person, maybe the wife, maybe the son, daughter, or whoever, caretaker sometime. And the family themselves need certain special type of need. They still are hospitalized. They cannot do any support. That's why they need the long-term care facility. Adult children are in the sandwich generation. Adult children, the client's sons and daughter, they marry, they have their own kids, they have their own disease process, own health condition, like a sandwich, grandfather, father, son, grandchildren. It's like a sandwich generation. They are caught between their own children. Somebody must be looking after the young children, not the old parent who need attention and an ill parent who needs care. See, the person is in between the two reality. On the one hand, the parents are sick. On the other hand, the children are very young. Whom to care? It's a sandwich generation, very difficult situation. Caregiver need much support and encouragement. The person who gives the care, they feel very, very tired because the behavior of the person of those last stage of dementia, they are very violative. They are very aggressive. They are very depressive. They are very combative. They are not encouraging to the caregiver. They may be yelling at you, hitting at you, physically abusing you. At that point, caregiver need much support and encouragement. Mainly join Alzheimer's disease support group. There are certain group, the government organization are helping those people for the supporting of those dementia or Alzheimer's disease. The family often feels helpless because family are very, their money is already drained. They can no longer contribute anymore financially. That's why the family often feels very helpless. No money, no interest, no energy. The family is an important part of the healthcare team because in the government's healthcare team, families are an integral part, very important part, significant part. They are incorporated in the client's care. They need support. Therefore, the family needs support and understanding from the healthcare team. Always the healthcare team, they are asking who are your family, who is your family, who are there in the family, who is taking care of you. And our role is just to observe, just to help from our part. That's it. Thank you for your patience and listening to the lecture. Have a great time. Bye.